Hello, my name is Rebecca Rivera and I will be narrating this lovely presentation on the disease endometriosis. Endometriosis, or endo for short, is a chronic disease that affects the reproductive tract of women. It affects 10% of the population and currently has no known cures. There are many symptoms with endometriosis, but the main one is painful and heavy menstrual bleeding. Other symptoms include dyspareunia, pain with sex, menorrhagia, bleeding between periods, menometrorrhagia, heavy bleeding, fatigue, nausea, bloating, ovarian cysts, infertility, and gastrointestinal problems such as constipation and diarrhea. There are quite a few risk factors that contribute to developing endometriosis, but no reason is set in stone. These factors include genetics, an early start to your menstrual cycle, late menopause, a low body mass index, consumption of alcohol, never being pregnant, uterine abnormalities, a menstrual cycle that is shorter than 28 days, and high estrogen levels. Endo is an estrogen-dependent disease, which means high estrogen levels help feed it. Endometriosis can be diagnosed a few ways, but the only way that is 100% sure is laparoscopic surgery, which is also called keyhole surgery due to the small incisions made. A camera is inserted into these incisions to allow doctors to see internally. The surgery is done under general anesthetic and is usually outpatient. The healing time is fairly minimal, and the restrictions are as well. Endo presents itself as adhesions, otherwise known as scar tissue, lesions, and cysts called endometriomas. Endometriomas are filled with old blood that has turned brown and thick. Due to the appearance of the blood, they have been nicknamed chocolate cysts. Other diagnosis options include blood tests and pelvic exams. Blood tests are used to rule out any other diseases, and pelvic exams are used to feel for abnormalities. Thankfully, there are quite a few treatment options for endometriosis. These options include over-the-counter pain medications such as Midol, hormonal contraceptives, Lupron, a chemotherapy drug that medically induces menopause, a newer drug called Orilissa, approved by the FDA for treatment of endo, and laparoscopic surgery. Surgery uses ablation and excision to remove lesions, cysts, and adhesions. Ablation cauterizes the lesions and is typically used for ones that are smaller. Excision removes the lesions completely by cutting them out and is used for deeper-rooted lesions. There is a variety of hormonal birth control available. Options available are the IUD, such as the Mirena or Kylena, the patch, the oral pill, the vaginal ring, the arm implant, or the Depo-Provera shot. Birth control can either be a combination of estrogen and progestin, or it can be progestin only. Progestin-only methods are typically recommended for endometriosis, as endo is a estrogen-dependent disease. There are quite a few resources for women with endometriosis. These resources include self-help books, discussion boards and forums, a Facebook group called Nancy's Nook, which helps women find gynecologists and surgeons who specialize in endometriosis, and a subreddit on the website Reddit called Endo. Endo contains many helpful posts and tips on how to deal with endometriosis, as well as a successful doctor's list